So welcome to everyone who's new. I noticed a lot of new names signing up for the webinar this evening. My name's Rohini Bajekar, and I'm a plant-based nutritionist and on the advisory board of Plant-Based Health Professionals UK. I'm really delighted and excited to announce our speaker for this evening, Dr. Shivam Joshi, who's a nephrologist based in New York City. And I'm sure a lot of you on this webinar have already read some of his amazing papers. And we're going to be discussing plant-based diets in chronic kidney disease. We're very grateful to our sponsors who enable us to put on these webinars: ProVeg International, veganfitness.com, Oatly, and we're also CPD accredited by the British Society of Lifestyle Medicine. So all healthcare professionals will receive a CPD certificate in their inbox after this session. Plant-Based Health Professionals UK is a community interest group, and we've just reached 500 members from all over the world. And we're dedicated to promoting the benefits of a whole food plant-based diet, and membership is open to everyone, not just healthcare professionals. Do join us again in a couple of weeks, as we'll have the founder herself, Dr. Shireen Kassam, who's a consultant hematologist and lifestyle medicine physician, discussing how to improve cancer outcomes with a lifestyle approach. October is actually dedicated to the topic of cancer, and we'll be joined by a registered dietitian from Canada who specializes in nutrition management of patients undergoing chemotherapy and other cancer treatments. We're very excited to announce the UK's first ever Whole Foods Plant-Based Health Challenge. It's a 21-day plant-based health challenge, and the website is going to be going live tomorrow. It was developed by Dr. Leila Dagan, who's on the advisory board at Plant-Based Health Professionals UK, and it's full of incredible recipes, nutrition advice, and motivational tips, and it's completely free. So definitely go and check out plantbasedhealthprofessionals.com tomorrow, which is also World Vegetarian Day. We're also going to be putting on a cooking social, and the topic's actually changed. It's going to be comfort food classics, and that's for the PBHP members in a few weeks. Membership is open to everyone, and you can visit pbhp.uk to subscribe to our newsletter for free, or donate if you enjoyed this webinar via pbhp.uk/donate. Follow us on Facebook, Instagram, and Twitter, where we're very active. So now I'd like to welcome Dr. Shivam Joshi to start the presentation, and then we'll be having about 15 to 20 minutes of live Q&A after the presentation. Okay.
Okay, great. Hello, everyone. My name is Dr. Shivam Joshi. Thanks for joining, and thanks for having me here, Plant-Based Health Professionals UK. So let me share my screen and get started. And let's present from the beginning. There we go. And we'll close this. Okay, so the title of my talk is Plant-Based Diets for Kidney Disease. And I'm a nephrologist here at NYU, New York University, and Bellevue Hospital in New York City. And I have no disclosures. And this is the kind of the overview of the things that we'll be talking about today. So we'll be talking about the likely benefits of plant-based foods in kidney disease, which includes issues related to phosphate levels, acid levels, blood pressure, and kidney stones, and then the probably likely benefits of plant-based foods in kidney disease. So that the evidence is less certain in this area, but there's still some evidence to discuss. I've lumped them together here, and these are the direct effects of animal versus plant protein on the kidney, issues related to mortality, fiber, and potential reversal disease. And then towards the end, we will talk about some of the common concerns of using plant-based foods or plant-based diets in CKD, which is related to potassium and protein, and then the big picture in conclusion. And then I use the word CKD, which I believe is the terminology used for all of you in Europe or elsewhere. But if not, what I mean by that is chronic kidney disease. So let's talk about hyperphosphatemia, which is high levels of phosphate in the blood. So for folks with normal kidney disease, normal kidneys, I should say, phosphate levels are maintained within the normal levels. The kidneys excrete phosphate, and so they don't rise. But when kidney function declines, phosphate levels rise, and this is an independent risk factor for both death and death in patients with CKD and also those on dialysis. And because of that, we tell our patients to reduce the amount of phosphate they take in. But this is very difficult because phosphate level content is not disclosed, at least on the labels here in the United States. So for our patients with advanced CKD and or on dialysis, it's difficult. One of the things that I like to bring up is that there is a difference in the amount of phosphate bioavailability between plant and animal proteins. Although plant-based proteins have more phosphorus than animal-based proteins, this phosphorus is mostly bound as phytate, and it's not absorbable. The reason being is that phytate is a storage form of phosphorus, and in order to release the phosphorus from phytate, you have to have this enzyme called phytase, and humans do not have this enzyme. So which makes the bioavailability of the phosphate in the in plant foods much lower than in animal foods. So on average, as you can see in the box, it's between 10 and 30%. And animal foods like dairy and meat are between 40 and 60% bioavailable in terms of their phosphorus. And then processed foods have added phosphorus to their foods, usually as an additive or a preservative. And this added phosphorus is 80 to 100% bioavailable. So what we call this the rule of thirds: 1/3 bioavailability for plant protein, and then 2/3 bioavailability for your animal products, and then 3/3 or 100% bioavailability for your processed foods. Notoriously, your dark sodas have a lot of bioavailable phosphate, 100% bioavailable phosphate. So that's another thing to watch out for. This has been studied in humans. It's also been studied in animals. This is the human crossover trial. This was a short trial, short and small trial, 8 patients lasting 1 week. And they fed both of these groups, the vegetarian diet group and the meat diet group, the same amount of phosphorus. The only thing that differed was where the protein came from. So in one group, the protein came from casein, which is milk protein, and then the other group, it came from grain. And what they saw in this crossover trial is that those eating the vegetarian diet, eating the protein from grain, had lower plasma phosphorus levels. So it's consistent with this idea that plant protein has a lower bioavailable phosphorus. There is a caveat to this. There's always a catch to everything in life. So even though we lack phytase, which is that enzyme to digest phytate in plants, it can be broken down with industrial processing. So that includes foods made in a factory, so your processed foods and even your baked bread. But it cannot be broken down by home cooking. So if you're doing the cooking at home, likely the tools and gadgets and the type of cooking you're doing is not intense enough to break down phytate. So changing gears, since we have a lot of ground to cover in this talk, we'll talk about basically the accumulation of acid. And as these are all things that the kidneys would normally take care of, phosphorus, acid levels, but as kidney function declines, we see these issues pop up, and they're reflective of the kind of silent and unsung work that the kidneys do 24/7. And the accumulation of acid in the blood because of declining kidney function results in this issue called metabolic acidosis. So as I stated earlier, kidneys normally lower these acid levels. They rise in kidney disease. And the principal source of acid actually comes from dietary proteins, specifically animal proteins. And we'll discuss that in the next slide. However, the treatment for this has been the opposite of acid, which is alkali. Many of you may be familiar with alkaline water. This is a more potent form of that. This is basically baking soda, which you may be familiar with in baking. But we give this to our patients. It's sodium bicarbonate, and this neutralizes the acid. So the average dietary acid load is 50 to 75 milliequivalents per day in America. And that is reflective of a diet high in animal protein and low in fruits and vegetables. And this may be similar to other Western societies like those in Europe as well. And as you can see here in this diagram, the foods that are more acid producing tend to be of animal origin. So these are going to be your cheeses, your eggs, your meat, poultry, fish, things like that. Grains, rice, pasta, milk, lentils, they tend to fall in the neutral area, wine, coffee. And then you start getting fruits, vegetables that tend to be more base producing. And a diet that is vegan, it tends to be acid neutral or nearly acid neutral. So as I was stating earlier, the current treatment for this issue is baking soda, which is alkali or sodium bicarb. And several randomized controlled trials have shown that 2 to 4 cups of fruits and vegetables is just as effective as treating patients with sodium bicarbonate. So historically, what we've been taught as physicians in our training and as we graduate and then as nephrologists is that we should reflexively prescribe sodium bicarbonate to treat metabolic acidosis in patients who have declining kidney function. But it was only in looking into the literature that I learned that diet plays a role in this too, and substantially. So fruits and vegetables have natural alkali. So you don't need to get alkaline water. What you actually need is alkaline food. And the reason being is that they have these components like citrate, malate, and bicarbonate that get converted into bases that neutralize the acid. Fruits and vegetables have this added benefit over baking soda or sodium bicarbonate because they don't have sodium and they have other components to them like fiber. And in studies, what we've seen is that these patients who are on fruits and vegetables for treatment of their metabolic acidosis also experience additional benefits like weight loss, a reduction in their blood pressure, and reductions in the amount of their urine protein. And with everyone's fears of potassium, these studies did not show an increase in potassium levels, but these investigators were certain to exclude those who had a potassium greater than 4.6 here in the US. So this led to several editorials. This is just one of them saying that the key to halting progression of CKD might be in the produce market, not in the pharmacy. And you can see here the picture of the fruits and vegetables and then the pills. And one is clearly more appetizing than the other. And then the reason that was listed as it or titled as it was is that treatment of metabolic acidosis can actually affect the progression of kidney disease, and this was shown in several randomized controlled trials, but most notably in this recent 5-year update of their trial. And what they showed was there's 3 graphs here. The one on the left just shows a group of patients who did not receive any treatment for their metabolic acidosis, and what happened was their kidney function declined. On the left-hand side, on the vertical axis, you have estimated glomerular filtration rate, which is their kidney function. And then on the bottom axis, you have ears. And as you can see, that black line is steep. In the middle, you have the group that was treated with bicarbonate pills. And then in the right graph, you have the group that was treated with fruits and vegetables. The important thing is that fruits and vegetables and the pills both were comparable to each other. There was no real difference detected. So fruits and vegetables are just as effective as giving pills in helping treat metabolic acidosis and also slowing the progression of kidney disease. And notably that they are both better than doing nothing. And people ask me, what special beans were people eating? What special fruits and vegetables? And really, there's nothing special to it. And looking at their paper, the things that they were providing to their patients, the fruits that were provided were apples, apricots, oranges, peaches, pears, raisins, strawberries. And the vegetables were carrots, cauliflower, eggplant, lettuce, potatoes, spinach, tomatoes, and zucchini. So nothing out of the ordinary. These are all things that many folks can find in grocery stores, not only in America, but I would assume all across the world. And as I mentioned, those eating fruits and vegetables also have significantly lower blood pressures, lower weight, 4 kilograms, that's substantial. Lower blood pressures, 8 millimeters of mercury systolic. And again, no elevated potassium. That's what that hyperkalemia word means. So on to high blood pressure. So why am I talking about high blood pressure? Well, high blood pressure is actually very important. As nephrologists, we spend a lot of time dealing with high blood pressure because not only is it a cause of kidney disease, but also a complication of kidney disease. It's a cause, at least in the United States, it's the second most common cause of kidney disease and kidney failure. And it's also a complication because as kidney function declines, it stops doing an essential function, which is getting rid of salt or sodium. And because of this accumulation, this leads to high blood pressure. So at least in America, a lot of people have it. I suspect my audience isn't too many Americans today, so I won't dwell on this too much, but I suspect that in many Western societies, the prevalence of high blood pressure increases with age, and the numbers are probably close to this regardless of the specific country. However, high blood pressure is not destiny. Indigenous societies have had normal blood pressures or stable blood pressures as they've aged well past 60. So it's certainly not a normal facet of aging, but we in Western societies are convinced that it is. And because of this and other studies, people have noted that those eating plant-based diets actually have some of the lowest blood pressures in industrial societies. The first time this was noticed was in a group of strict vegetarians in Massachusetts. And these were their blood pressures. And what they noticed is that your typical omnivorous person living in the Boston area had the highest blood pressure. And as they became progressively more vegetarian, they had lower blood pressures, both systolic and diastolic. And this has also been seen in large cohorts. So the Adventist Health Study 2, almost 90,000 participants, those who were eating progressively more plant-based had a lower odds of having high blood pressure. And one of the criticisms of this in the literature is that, well, people who eat plant-based weigh less, and we know weight raises blood pressure. So if they weigh less, not surprising that they have lower blood pressure. Okay, that's true, but not all of the effect is actually related to just weighing less. So when you adjust for BMI, you can, in this, from the Adventist Health Study 2, you can look at it adjusting for BMI or not. And that's the top table. When you adjust for BMI, you still see there's a significant reduction in blood pressure. Granted, it's not as big prior to adjusting, but it still remains a significant effect. And then you can also look at it by looking at levels of progressive movement towards eating a plant-based diet within the same strata of BMI. And so if you look at non-vegetarians as a reference, partial vegetarians have a modest decrease, lacto-vegetarians a bigger increase, and then generally vegans the largest increase. But some of those were barely non-significant. Again, this was also seen in the EPIC Oxford cohort. The lowest incidence of high blood pressure was in vegans. Half of the variation in blood pressure was explained by the BMI or body mass index. And again, half of the variation was not. So there still is a little bit of attribution to the actual foods being consumed itself. Vegetarians ate 5% fewer calories, vegans ate 14% fewer calories. Not surprising. This is probably one of the biggest this is actually the biggest study to date. This is analysis of 3 large prospective cohorts here in the United States, nearly 200,000 people with nearly 3 million person years of follow-up, and it adjusted for a lot of risk factors. And what this found was a positive relationship between the consumption of eating any animal flesh, red, processed meat, poultry, seafood, with the development of high blood pressure. And this also included poultry and seafood, which many people find surprising. So all of this has led to people to think, well, maybe diet can be used to lower blood pressure. And this was this prior to the DASH diet, there were these pre-DASH trials, as I like to call them. They were done in Australia, and they showed that those eating a vegetarian diets were able to lower blood pressure. The graphs are confusing, but basically what it showed was that when people were actually on a vegetarian diet, their blood pressure did decrease. And this led to the DASH diet. And in this paper, they explicitly said that the diet was designed to create a pattern that would have the blood pressure lowering benefits of a vegetarian diet. It contained enough animal products to make them palatable to non-vegetarians. So this led to the DASH diet. The DASH diet is a very popular diet here in the United States, and I'm sure elicits some vague memories or recollections of this diet for those outside of the United States. The first DASH diet just looked at different dietary types. It did not control for sodium intake. So it took 459 adults, randomized 3 diets. They used a control, which was a standard American diet, a diet, quote unquote, rich in fruits and vegetables, but had some limitations. It was high in fat. And then also the DASH diet, which was their attempt to achieve the rationale that I mentioned earlier. This contained the benefits of a vegetarian diet, but make it palatable enough to non-vegetarians. So what they did is they included fruits, veggies, some low-fat dairy, and reduced saturated total fat meats, so poultry and lean meats and things like that. And there was 3-week run-in and 8 weeks of experimentation. And at the end, what they saw was that the experimental diets did lower blood pressure to control diet, not surprisingly. And then the combination diet, which was a DASH diet, worked better than the quote-unquote fruit and vegetable diet. So I think the fruit and vegetable diet, which is the middle bar, was mislabeled, and it isn't a quote-unquote fruit and vegetable diet, even though that's what they titled it. It still included significant amounts of added oils, salad dressing, snacks, sweets, beef, and pork, and things like that. So it wasn't the ideal diet. And they later did a subsequent study with sodium, and they showed that restricting sodium had even bigger effects when you combine it with the DASH diet. And then finally, there was this study, which was a secondary analysis of those 2 studies, the DASH and the DASH low sodium diet. And what they did was, what their question was what is the maximum reduction in blood pressure with diet? And then what they showed here is that eating less salt in a DASH style diet can reduce blood pressure by 21 points systolic and 8 points diastolic. And this is an enormous decrease in blood pressure. This is like going from 150/90 to 129/82. This is perhaps having uncontrolled high blood pressure, being already on a couple medications, and perhaps needing a couple more, to going to have a totally normal blood pressure. So a substantial reduction. So every time I give this talk, my question is, can adding more plant foods to the DASH diet improve this blood pressure reduction even more? And this is yet to be answered. The reason for the reductions in blood pressure are multifold. They're related to animal protein. They have they tend to be higher in sodium, lower in potassium, tend to cause weight gain. There's some issues regarding the amino acid type and increased oxidative stress, and basically the opposite with plant protein. Some of my nephrology friends and I wrote this review in the American Journal of Lifestyle Medicine, basically summing up all these points in a very large paper, but it includes everything at that time on this subject to basically make the case that plant-based diets are useful for hypertension. Kidney stones are a common issue when people think of kidney doctors, and I would be mistaken to not mention this in any presentation. So at least in the United States, the prevalence of kidney stones is around 10%, and that is probably higher now. The most common stone is a calcium oxalate stone. 70–80% of stones are comprised of calcium oxalate. And the risk of recurrence is 40% at 5 years and 75% at 20 years. I suspect these numbers are probably similar throughout the westernized world. However, there's been an association with animal protein and kidney stones dating back to the end of World War II, when many modern societies started to increase their intake substantially of animal protein. And this is an editorial that was written in 1979, and the authors wrote, "Should recurrent calcium oxalate stone formers become vegetarians?" Calcium oxalate stone is the most common type of stones. So basically, it's just asking, should people who have stones become vegetarians? And in the literature, if you dig enough, you'll find people basically saying that. There's one paper in Journal of Urology in 2014, the authors wrote, "Stone formers should be advised to limit the intake of all animal proteins, including fish. Animal protein consumption raises urinary levels of calcium, oxalate, uric acid, and the acid levels, and all of these increase stone risk." Counter to popular opinion, many people think that if they have a calcium oxalate stone, they should cut back on their calcium intake. That's not actually true. What it should be done actually is the reduction of animal protein and sodium or salt. And this was actually shown in a randomized controlled trial published in 2002 in the New England Journal of Medicine. Those eating animal protein and salt restricted diet had a lower incidence of stone recurrence after 5 years compared to those who were on a low calcium diet. And in several population studies, vegetarians have been noted to have a lower risk of kidney stones. And here's one of those studies. This is the EPIC cohort, 51,000 people in England and Scotland. Vegetarians were associated with 31% reduced risk in kidney stone formation, and the top tertile of meat eaters had a 64% increased risk in stone formation. Unfortunately, there is almost no information regarding vegans, and that's an active area of interest on mine, and which hopefully in the near future there will be some research to comment on. So why are fruits and vegetables so helpful? And that's because they lower urine acid levels, they lower uric acid, they lower urine calcium excretion, they lower sodium excretion, and they increase urine citrate. They basically have a lot of effects on the chemistry experiment that happens every day, every time you urinate or make urine. They basically change the ingredients in the chemistry experiment to favor not having a stone, whereas animal protein does the opposite. And actually, when you come to see a kidney stone specialist like myself, you may be prescribed a medication called potassium citrate. And this is actually just plant foods in capsule form to help treat kidney stones. And I thought I was just making this up, but then I read this paper and this other guy wrote the same thing. He said the only reason we prescribe potassium citrate is because, quote unquote, an alkaline ash diet is difficult to follow for most patients. And it's interesting that the diet is referred to as an alkaline ash diet. It's really just a diet of fruits and vegetables. At any rate, but to even break it down further, potassium is found in fruits and vegetables, and then citrate also found in fruits and vegetables. At any rate, but then the biggest question that I get when I give this talk is, what about all those oxalates in plant foods? And not infrequently, someone sends me this paper, this green smoothie cleanse causing oxalate nephropathy. You can get oxalate stones by eating a lot of oxalate-containing foods, but the person in this study and in many other instances generally have a lot of other risk factors. So to back up a little bit, oxalate is a compound found naturally in plants to bind to calcium. It's thought to facilitate growth of plants in areas of high calcium levels in the soil. And some extremely high oxalate-containing foods like spinach, Swiss chard, beet greens, rhubarb, cashew, starfruit, dark chocolate potatoes, black tea, and a few others can lead to a calcium stone if you eat them frequently. So if you if you had spinach last week at the deli or the sandwich or the lunchtime salad store, you're not going to get a kidney stone because of that. What I'm talking about is someone who's eating a bag of spinach 3 times a day. That person may get a kidney stone if done incorrectly, if they also have risk factors. So there's a little bit more to it. So first, dietary oxalate restriction results in a trivial reduction in urinary oxalate in the average person. So in several studies, what they've shown is that restricting dietary oxalate doesn't affect the amount of oxalate in your urine. And this is important because the amount of oxalate in your urine is ultimately what leads to having a stone. If you have extremely high oxalate levels, which is called hyperoxaluria, that will definitely put you at risk for a stone and have a stone. And there are patients who have this, have high levels and have it chronically. And these people should be monitored under the supervision of a nephrologist or some other stone specialist. And these patients should definitely avoid eating these ultra high oxalate foods. But the average person, in the absence of having this diagnosis, certainly should not. But it doesn't mean that you should really challenge yourself and see if your body can avoid having a stone by guzzling these foods. These foods can put you at risk. So it is helpful to be mindful of that. And especially if you have bowel disease or bowel surgery, intestinal problems, if you've been on antibiotics recently, or you're taking vitamin C supplementation, these are those other risk factors. So the combination of these things can put you at risk for having a kidney stone. It's not just about the Swiss chard or the spinach. At any rate, moving on, I would like to talk about the probably likely benefits of plant-based foods in kidney disease. And the first one is animal protein directly bad for the kidneys? And it's a question I get a lot, and fortunately, you're in luck. Get it? It's harder to tell if these jokes are landing because I have no ability to hear any laughter. So for patients without kidney disease, there is evidence from observational studies that animal protein may have an adverse effect on the kidney. And this comes from observational evidence. These are cross-sectional studies that suggest that those eating plant foods have been associated with a lower risk of protein in the urine and developing kidney disease, and those eating animal foods have been associated with the opposite. And in one study, replacing 3% of energy from animal protein with vegetable protein lowered the prevalence ratio for the association with renal impairment to 0.20. So basically 80% reduction in risk of developing kidney function impairment in that one study by replacing 3% of energy from with a plant-based source. And similar evidence comes from prospective cohort studies, so a slightly higher level of evidence. Those consuming plant foods have been associated with a lower risk of kidney disease, kidney failure, protein in the urine, or rapid decline in kidney function, whereas animal foods have been associated with the opposite. Replacing one serving of red meat with soy and legumes was associated with a 50% reduced risk of developing kidney failure. So for patients with kidney disease, what are the effects of animal protein on renal health? This is an important study to talk about, and what they showed here is that briefly that those eating animal protein, for every 10-gram increase in animal protein intake, there was a significant association in the decline in renal function in the women who were studied. And these were women who already had kidney injury. These effects of animal protein have also been seen in several experimental trials. And what they've showed is that animal protein has slightly increased the protein in the urine versus those consuming plant protein has slightly lowered the amount of protein in the urine. And the reasons that there might be a difference in effects from the protein are multifold. This can be related to the concept of hyperfiltration, which is essentially working the kidneys harder, the acid content, changes in the microbiome, sodium, inflammation, and many of the positive things that are found in plant foods. This concept that animal protein causes the kidneys to work harder can be seen in several observational studies. So kidney function is defined by this term called GFR, which is can be loosely interpreted as basically being a percentage of kidney function. So vegans have been found to have a GFR of 100%, vegetarians, 100, which can be interpreted as being 100%, vegetarians at 105, and omnivores at 113. What you also notice in parallel is that as you move from left to right, these groups also eat more protein. And this protein tends to be more animal-based. So based on this, we think that animal protein tends to cause, well, based on this, we think protein causes the kidneys to work harder or increase the amount of GFR there is, but also animal protein specifically. And is this harmful? We are not totally sure. So this issue with hyperfiltration that occurs with excess dietary protein is thought to be harmless in those without kidney disease. I am guilty of writing papers that have suggested otherwise, but that's just because we don't know for sure. And then for those with kidney disease, it is thought to be harmful. So eating excess protein and perhaps animal protein as well are thought to be harmful if you already have kidney disease. Again, this is just saying the same thing over. Excess protein is thought to be not harmful. There's several papers on that. And then those with kidney disease eating excess protein, specifically animal protein, is thought to be harmful. And this was a recent paper by my friend Cam Callentar, who wrote in the New England Journal of Medicine, saying that the protein for those with kidney issues or mild to moderate CKD should be reduced and emphasized from plant-based sources. And there is an evidence of benefit of eating lower protein diets or low protein diets. The terminology varies in those with kidney disease. A big study for the nephrologists in the community did not show an effect, but the secondary analysis did. MDRD was a negative or positive study, depending on who you talk to. It's like glass half full, glass half empty. To me, it did show an effect based on the secondary analysis. The 3-year study should have been extended out a little bit longer, and I think it overall would have been positive. So the big question is, do plants cause less hyperfiltration, which is this issue of overworking the kidney? So basically, is there a difference between plant or animal protein in terms of how the kidneys handle them? And there's really only one experiment to offer any insight. And if I've confused you, it's not my intention. It's because this topic is confusing with so little evidence on it. And this is really the only study on it. On this, and what you can see here is that it was a 3-week study, 10 people, and they were fed animal protein and they were fed vegetable protein. And basically what it showed was, with keeping the amount of protein the same, is that people who were eating the vegetable protein had a decrease in how hard their kidneys were working. So their kidney function went down from 121 GFR to 111. For those on the internet who are not as savvy with how the kidney works, in the literature will interpret this as, oh, the kidney function declined and that was a bad thing. For many people who read the paper, like myself, and understand what's going on, is that this is actually a loss of hyperfiltration and that this is actually a good thing. So are all plant foods the same? Most definitely not. There was a recent study looking at, and it said eating a healthy plant-based diet was associated with a lower risk of kidney disease, whereas an unhealthy plant-based diet was associated with a higher risk of kidney disease. What foods would classify as part of a healthy plant-based diet? Well, these are your typical healthy foods: fruits, vegetables, whole grains, nuts, legumes, things like that, tea and coffee. And unhealthy, your usual suspects: refined grains. I don't like how they put potatoes here, because not all potatoes are bad, but they lumped it all together because frequently the most common form of potatoes tend to be chips and fries, but baked potatoes certainly should be in the healthy category. Fruit juices, your sweetened beverages, sweets, desserts, animal fat, dairy, meat, fish, seafood, eggs. So well, I have a glass of water here. These are some of my favorite kidneys. Of course, my favorite is kidney rock. So for the sake of time, I'll probably just run through these a little quickly. Kidney disease is extremely deadly. For many with kidney disease, the biggest fear is going on dialysis, but really the biggest fear for me is actually not even making it to dialysis and actually passing away before then. And then for those who do make it to dialysis, the 5-year survival rate is abysmal. It's 42%, which is worse than early stage lung cancer. And plant-based diets have been associated with a reduction in mortality in observational studies and prospective cohorts and CKDs. Was a meta-analysis showing a reduction. And again, the similar finding in those on dialysis. I love fiber. Fiber is probably the unsung hero of plant-based diets in relation to kidney disease. There's so much that we talked about fiber. This used to be just one slide in my talk, and I made a different talk for dialysis only, and it's now expanded to maybe 10 or 15 slides. But I think this is maybe 1 or 2 slides here. But basically, fiber has a large number of beneficial effects in kidney disease. It reduces acid load with the associated bicarbonate that comes with plant foods. It changes microbiome, reduces uric toxin production, perhaps reduces inflammation, associated reduction in risk of cardiovascular events. I could go on. Everyone's favorite is reversing disease, including mine. Several case reports in regards to lupus showing this. It's very exciting. I want to see more research. The best published case is this one by who I can now say, also my friend Dwayne, who we've presented together at several talks. And his story is just incredible. Just had kidney failure from minimal change disease, and then adopted a whole food plant-based diet, and now has normal kidney functions off meds, and is swimming and cooking, and is now teaching and educating others about his story. Potassium is a big issue. I'll pause here for maybe a couple seconds. So plant foods have been excluded from quote unquote renal diets for a long time because of the potassium content. But the recent research suggests that it may be overstated, at least the risk of it. There are factors that can mitigate the rise in potassium in kidney disease. And that includes fiber. Fiber comes out as the winner in many cases. It leads to larger and more frequent bowel movements, leading to potassium loss. Interestingly enough, the colon can actually secrete more potassium in kidney disease. Up to 80% dietary potassium can be secreted in the colon. Potassium can also move into the cell due to improved insulin sensitivity and natural alkali. And there's also now thoughts that bioavailability may vary. Some people think it's related to the presence of cell walls in animal foods. In one study, no more than 60% of potassium found in plant foods was absorbed or bioavailable. There's a recent review of case reports, and in many of these cases, a review of case reports of high potassium in patients with and without kidney disease, and they looked at what was the food or item that was ingested that led to the high potassium level. And most of these cases were actually related to juices, sauces, dried fruit, or frankly, just potassium supplements, salt substitutes, but not specifically your unprocessed plant foods. And that's important because juices and sauces are basically potassium liquid extractions from their original fruit or vegetable form. Fruit juices have potassium in concentration. Someone may drink a glass of orange juice, for example, but they won't eat the 2 or 3 oranges that would have been necessary to make that glass of orange juice. And by extent, you're extracting the potassium out of these foods and not getting the fiber or any of the other benefits. Similar issue with sauces and dried fruit. It just increases the amount of potassium that's consumed over time. And people have written that the risk of high potassium has been overstated, and maybe we're doing more harm than good by avoiding these potassium-containing foods like fruits and veggies. And then looking at the evidence, there's only been one case of high potassium in those eating plant-based foods, and this person had a type 4 renal tubular acidosis, for my fellow nephrologists out there. And in this case, this person had this issue corrected by eating fried tofu. Not that I would recommend eating fried tofu. Baked tofu would probably be fine. This person was eating raw soybeans, which is one of the highest potassium-containing foods, and I don't recommend the consumption of raw soybeans. If you cook them, you'll get a lot less potassium through losses in the water. At any rate, several studies have also shown that have shown that potassium does not rise, even going down to stage 5 kidney disease when eating a plant-based diet. This is an older study. As you can see, potassium is 4.5, which is normal here in the United States. This is a great paper on the issue that my co-authors here at NYU wrote. My colleagues here talks about the issues related to potassium in patients on dialysis. And then in brief, you can get plenty of protein eating a plant-based diet. You'll certainly get enough. You just have to be mindful of the foods that you're eating. And even if you're on dialysis, there's several studies showing that patients can get enough protein. And my co-authors and I wrote this paper basically illustrating all these points. And it has a real-world scenario of how you can get into trouble. For any of these papers, I'm happy to share them. So in the last 60 seconds, I just want to wrap this up. So when I became a medical student, I started at the University of Miami. I had no idea what kind of physician I wanted to be. This was back in 2008. That was at her white coat ceremony. I somehow have more hair now than I did then. Don't know how that works. And I listened to Will Smith's seminal song, Welcome to Miami. I became very interested in transplantation, kidney transplantation, because of the issues surrounding kidney transplantation. One of them is that supply exceeds demand pretty much wherever you go, not only in America, but all over the world. And then for those who are waiting, death comes sooner for many than a transplant, which is unfortunate. We talked about that before. So I wrote a bunch of papers on the issue with my mentor then and many other people, and I enjoyed it. And when I graduated med school, I still felt like I wasn't doing enough. So I went to work on an artificial kidney. And what I learned then is that making an artificial kidney is incredibly hard, if not impossible. And it may not happen in our lifetimes, unfortunately. What I did learn is that the main causes of kidney failure are diabetes and high blood pressure. And then after reading this book, the light bulb kind of went off. Type 2 diabetes, hypertension need not happen. Type 2 diabetes and hypertension need not be uncontrolled. And then type 2 diabetes and hypertension need not cause kidney failure. But unfortunately, that story is too common. 75% of kidney failure is from diabetes and high blood pressure. 90% of diabetes type 2, and 90% of type 2 is preventable. And similar story with high blood pressure, 80% of high blood pressure is preventable. And there's a lot of similar quotes on this. An ounce of prevention is worth a pound of cure, said a famous man in Philadelphia. And then Christian Barnard, a South African heart surgeon, said, I've saved the lives of 150 people by heart transplants. If I focused on preventive medicine, I might have saved 150 million. So fast forward to now, I did my residency and fellowship, and now I'm a nephrologist, but also a primary care physician. And the reason being is that preventing kidney disease is just as important as treating it. So a whole foods, plant-based diet prevents and treats lifestyle diseases and the complications of those diseases like chronic kidney disease and the complications of those complications like metabolic acidosis, hyperphosphatemia, which we discussed today. So the goal is not to get everyone to eating a perfect meal, but at least moving along the spectrum. And there's many people I like to thank, but I'm over time, so I'll leave it there for questions.
Thank you, Shivam. I'm just going to stop your screen share. That was fascinating, and we have about 25 questions that we won't go through. So I'm going to kick off with my own question, which I know that this is something that you've already written about, but I wanted to understand a little bit about how this affects ethnic minorities. In the UK, Black and South Asian communities and people, are 5 times more likely to suffer with chronic kidney disease than Caucasian groups. Could you talk a little bit about why this is? And I know there's been some research showing that the prevalence is as high in US cities as it is in India, with Indians specifically. So why is that?
Yeah, it's probably related to the underlying causes of kidney disease. So for many of these folks, it's still diabetes, it's still high blood pressure, and for many minorities, you could be, it doesn't matter really the race. You could be Indian, you could be black, you could be brown, or anything in between. Is, the socioeconomic factors play a big role. So education, access to healthy food, just having money to buy these foods, being able to go to the grocery store, having time to make healthy foods. I think all these things play a role and contribute to overall health. And then those complications of diabetes and hypertension then lead to kidney disease. So I think it's the same story everywhere, whether you're here in Bronx or Brooklyn or West Philadelphia, or, somewhere in London.
Mm-hmm. Yeah, that makes a lot of sense. So I'm going to ask a question from Dr. Gemma Newman, who says, great job. Thank you.
Oh, thank you.
Should we restrict potassium intake for end-stage kidney patients?
Yeah, well, thank you, Gemma. That's a good question. So yes and no. We should not be telling our patients that are on dialysis or end-stage kidney disease to avoid some of the healthiest foods on the planet, like fruits and vegetables. These foods should be consumed. But the things that they should watch out for are like your juices, your sauces, dried fruit, foods extremely high in potassium, like molasses in that chart. Those are things to be mindful of. We still want patients on dialysis to be eating healthy, but with just those few minor exceptions. And for the most part, they should be okay in regards to their potassium. And with any changes in diet, I recommend having the potassium checked periodically, because invariably they may not understand the first time around that they can't have juice or a sauce or something, and the potassium may go up. So as a safety measure, I always recommend having the potassium checked with those on kidney disease.
Okay. This question is from Dr. Shireen Kassan, who says, many people needing dialysis are told to eat more protein due to increased losses. Is this still the conventional advice? And if so, can these protein losses be met by eating plant-based sources of protein?
Yeah, so people on dialysis definitely need slightly more protein, slightly more, significantly more, however you want to describe it. And that is true. It's losses on dialysis. It's due to inflammation. It's due to a variety of reasons. But what we have seen, the recent guidelines just came out a month ago, and they're actually, the bar for protein is actually coming down. So the amount of protein that's being recommended is actually being reduced every time these guidelines come out. So it was I think 1.2 and above, and now we're down to I forget the exact number, but it's less and less, but people do need more protein. You can get more protein eating plant-based, and I cited those two studies in my PowerPoint.
Yes, and we are going to be sharing the copy of the presentation with everyone who's on this call. I think we had a few questions about that. We've had so many comments saying how accessible and informative and incredible the talk was as well, from people who had to sign off. Another question is from Despina, who's a plant-based dietitian in Greece, and she says, patients with CKD usually have low iron levels and several deficiencies along the way. What is your opinion with regards to supplementation, and could high doses of supplementation such as vitamin D and K, which is quite famous in, so I can't read that, but could that affect patients in a negative way, sort of high dose supplementation of vitamin D and K?
I don't think patients have to supplement specifically with vitamin K. Well, unless if they're on dialysis, but usually the water-soluble vitamins, which D and K are not, need to be replaced, and that usually comes in a vitamin called here in the United States, Nephrologist, or there's several different variations on that. But many patients with kidney disease do need supplementation specifically for vitamin D, either in the active or inactive form, because the kidneys work to convert vitamin D from inactive to active. So that supplementation is appropriate. And that doesn't matter regardless of diet. That's just for anyone with kidney disease to be supplemented with vitamin D. And usually the nephrologist will do that.
Okay, this question's from Victor Jones, and he says, it was an awesome talk, really clear delivery and slides, but he's got a tricky question. What more evidence would you say is needed before we could confidently say for both cardiovascular and renal patients that they should adopt a plant-based diet? I've not yet seen this in practice and not sure if, when I should be recommending it.
Yeah, so I think it's to present the information to a patient, which takes time. These foods can improve many parameters in between, not just the hard endpoints. So they can help lower cholesterol, improve insulin sensitivity, or help patients lose weight, or help lower blood pressure. So there may be reasons more immediate to help use these foods, and then over the long term, hopefully the evidence will come out showing that they have reductions in cardiovascular disease like heart attacks and stroke and death. And what we need for that are these large, long-term randomized controlled trials, which who knows will ever happen. But in the absence of that, a well-done observational study with a good number of people showing recurrent benefits or association to benefits would be helpful too.
Okay. Yeah, that's great to know. I think we've got time for one last question. I'm also just going to launch a quick poll to get feedback from everyone. This just takes 1 second. So that should come up on everyone's screen. But I wanted to know from you, looking at the data, what would you say is the most healthful diet according to the data that we currently have? And could you provide a bit more specifics on that?
Yeah, so I think if you look at the data in total, I think the recurrent signal is that plant-based foods are helpful for a variety of health parameters, be it for the prevention and treatment of diabetes or high blood pressure, obesity, cholesterol. And as we've seen, even for the complications of chronic kidney disease, eating a diet that emphasizes the consumption of your whole unprocessed fruits, veggies, whole grains, beans, lentils, nuts, seeds, things like that, is helpful. So that, and there are many variations to it. You can be flexitarian, vegetarian, Mediterranean, American, Indian, Chinese, many variations to it, but a diet that emphasizes the consumption of basically a lot of foods with fiber.
Great. And someone was asking about vegetable juices and fruit juices. What are your thoughts on that specifically?
Oh, stay away from juices. They will raise potassium in a heartbeat in patients with kidney disease. And if you don't have kidney disease, it's basically added sugar.
Sure, all the fibers stripped away.
Exactly.
And I suppose if you have to go for one, then a smoothie where of course the cell walls are broken down, but it still retains a lot of the fiber rather than juice.
Probably, yeah. The more fiber, the better.
Sure. And I think probably that, as you mentioned, sort of like the intact whole grains are even better, and then legumes and fruits and vegetables and so on, sticking to that, the closer the better.
Exactly.
Okay, wonderful. I think we have reached 8 p.m. here in the UK, so we're out of time, but we got so much information in that hour, and such fantastic information, and lots of new papers that many of us hadn't seen before as well. So I know lots of people will be looking those up after this session, and the recording will be available on our website in a few days for members of Plant-Based Health Professionals UK. But I just want to thank you. I know that you're incredibly busy and making time for this webinar, and we've got some fantastic comments that I'll definitely share with you as well via email later.
Great, my pleasure. I'm happy to have given this talk.
Wonderful. Okay, great. Thanks everyone for joining, and good night.